As a clinical nurse specialist, my focus is really on optimizing patient outcomes through the influence of three areas. One is the patient or family themselves, looking at patient outcomes, assessing for risks, lifestyle modification, stress management, functional problems, symptom problems, things like that. The second is through nursing practice, and that's where I really spend a lot of my time in critical care, because our patients are oftentimes intubated or sedated or in a state where they can't really talk to us because of the critical illness that they're experiencing. So I work a lot with the nurses and nursing practice to optimize practice, mentor, teach, coach, bring new technology to the bedside, get rid of technology that doesn't work anymore, look at the work that they do, but most of all, bring evidence-based practice to the bedside. I really believe that the key for a CNS is to build relationships. For example, you'll see me in scrubs today. To me, that's very important because what I've found is that nurses will not ask me to help them or look at me as someone they can go to if I don't look like them. And I don't mean that in a bad way. I mean, that's not a bad thing, but it's just like they're afraid to ask me to go help with a patient or go into a patient room if I'm in street clothes because they don't want me to get dirty, they don't want things like that. But then relationships, I make rounds, I talk to them, how's it going, what's going on, can I help you with anything? If they have a really sick patient, I've spent 6 to 8 hours, I've dropped everything else, spent 6 to 8 hours in the room just being an extra pair of hands. I believe that the only way that you can influence individuals is to gain their trust through relationship building. And so that's how I accomplish a lot. And then when I want to bring something new or bring a new evidence-based practice to the bedside, you've built a relationship and trust. So people may not like or want the change, but they're going to say, okay, I trust that you're going to help us out here. And the other thing that I do that helps build trust is when I'm at a table, I feel like I'm representing them when they can't be there. And I really try hard to be their voice. Or, for example, if somebody wants to implement something new, one of my things I always ask is like, what's the impact on the nurse? Well, how's it going to affect his or her work? I get to do a little bit of everything. I like to teach, I like to mentor, I like to coach, I like to design, I like to research and make it practical and bring it to the bedside. I like to influence practice, I like to help nurses, and this is the one job I've ever had in 25 years that allows me to do all of that. And it allows me to be, I get my satisfaction comes from a nurse saying, we missed you last week. You know, we noticed that you were gone and we had this question and we didn't have you here to ask. Or Dr. Gillespie saying, Kim, can you come to this meeting with me? And I know you have no expertise about this at all, but I need your management skills, your ability to ask questions to help us go to a different level. Those are opportunities that I cherish as being a clinical nurse specialist.